community. I am a student from Halatan University who can be kept at Legon Hospital from 8 to 2 this afternoon. I know your Mr. Name.
My name is Maurice Sofyan.
Okay, what do you like to be called?
Yes, Sofyan.
Okay, Mister. My goal is to come here to talk to you about the condition you are feeling. In addition, later I will do a physical examination to determine the physical condition of the Mister. The time is approximately 10 to 15 minutes. Is a Mister available?
Okay, I am.
How are you feeling today? Sleep well or not?
Not so good because my stomach hurts a lot and I don't sleep well.
Where do you feel it?
In abdomen nerve.
What is like? Is the sharp, dull, stabbing, painful?
The pain is like being stabbed.
On the scale 0 to 10, the number 1 to 3 is like on the scale where you can still move. At 4, 5, 6, the scale is moderate, which can interfere with activities. And at 7, 8, 9, the scale is severe, where you can move. On a scale of 1 to 10, what is the specified scale?
I think I feel at number 8.
Okay, when did you first notice it?
Yesterday.
How often does it happen?
Frequent and continuous pain.
Did it happen in a certain place or under certain circumstances?
In the stomach.
What makes it better?
With rest.
Okay, what makes it worse?
When doing activities and eating spicy food.
Okay, then I will review your demographic data. Can you state your full name?
My full name is Maulana Sofyan.
How old are you?
20 years old.
What is your address?
Sarah.
Where do you live?
I live at home with my parents.
Okay, what is your phone number?
0891123456.
Okay, are you married?
I'm not married.
Do you have health insurance?
No.
Not? Yes. What is your job?
I'm a student.
Who is your close relative?
My mom is the closest person to me.
Will you tell me about your condition?
Yes, of course.
Do you have problems with your bowel movement?
Yes, maybe.
Do you have a problem with your water life?
I don't think so.
How many times a day do you defecate?
5 times a day.
Is the stool format or loose?
Seems loose.
How is the consistency?
Liquid.
Have you ever had measles?
No.
Have you ever had rubella?
No, nurse.
Okay. Have you ever had polio immunization?
My mother said I had been immunization against polio.
Have you ever received diphtheria immunization?
Yes, of course.
Okay. Are you allergic to seafood?
Yes, I am allergic to seafood.
Is there a history of smoking?
No.
Is there a history of alcohol beverage?
No.
Is there a history of precious islands?
No.
Okay. Is there a history of hereditary disease in the family, such as high blood pressure, diabetes, heart disease?
My grandmother has high blood pressure.
Okay, then I will do a physical examination. I will do a head examination first. Are you ready?
Yes, of course I'm ready, nurse.
But on your head inspection there are no lesions and the size is normal. When I palpate there are no lines and the hair is evenly distributed. Then on my inspection my face looks symmetrical. There were no lumps, lesions and pimples on the face. His eye symmetrical. There are no abnormalities. I give light to the pupil. The pupil are dilated. The conjunctiva is not pale. The sclera is white, and there are no injuries to the eyes. I will test my visual acuity using the Snellen chart. Later, there will be letter that can be seen. Okay.
Okay, so
What is this letter?
L,
What is this letter?
A,
Okay, good. Then I check the nose and sinus. Is there a problem with your nose?
no nose,
Okay. The nose is right, the middle and symmetrical. Yes, and the septum right in the middle and both nostrils. Does it hurt when I press?
no fingers.
Do you have a problem in the mouth?
I don't think so.
Okay, 3. To open your mouth. Okay. Her teeth are neat and clean. There is no tartar and cavities, and her lips are pink and moist. Then is the paring. The uvula is pink, no lesion, and symmetrical, just behind to tenju and the tip of the throat. I check the ears. Yes, the ears canal are clean, right? And on hand, his range of motion is normal. The patient is able to move his limbs as flexion, extension, and rotation. Okay. Well, the action has been complete from the result of the assessment. The patient, on behalf of Maulana Abu Sofyan, 21 years old, the address in Serang, you are a student and your closer relative is your own mother, comes with complaint of pain in the lower abdomen. Pain like being stabbed with a pain scale of 8, and the pain has been continuous since today and has never had rubella and measles. Is fully immunized, has no story of smoking and alcohol, but has a seafood allergy. There is no previous history, and there is a family history of high blood pressure. On physical examination, the head was normal. There were no lumps, no lesion, and the hair distribution was even. The face looked symmetrical, the eyes were symmetrical, the pupils were dilated, the conjunctiva was not pale. The sclera was white, and the visual acuity was good. Then the mouth was clean, and there was no tartar. Moist lips, teeth, clean and tidy. There is no discharge in his ears. Then his paring is normal. There are no abnormalities. Then the range of motion is normal. Because you abnormal pain indicted you have dear hip. I will perform laboratorium tests as taking blood sample and feces sample with the aim of knowing the prevention and treatment of the disease that occurs to you. Maybe this will feel uncomfortable then when taking blood and urine sample. Are you willing?
Yes, I'm ready.
Can you give me your right arm?
Yes, okay.
If you feel pain or discomfort, you can inhale and exhale to reduce the pain.
Okay, yes, understand.
I do action yes. Next. The nurse put a tourniquet on the patient's arm. Hold your hand firmly.
Okay, nurse.
Okay. The nurse cleaned with an alcohol swab and the nurse started the blood sampling after it is stored in the blood tub. Okay, the collection. Okay, the collection is done.
Yes, nurse.
Okay, I'll be back and will tell you the laboratorium results that have been checked. Thank you for your time and for being cooperative. I'm sorry, have a good rest.
Thank you again, nurse.
Okay, then I will take a urine sample. Can you go to the bathroom to collect urine into a container?
Yes, of course.
Okay. Assalamualaikum.
Waalaikumsalam.
Excuse me, can you tell me your name?
My name is Mustafa.
Okay, mister. Here I will compare the ratio of the laboratorium with the ratio of 12,000 lymphocytes and 19,000 lymphocytes. Then the feces sample is normal. The ketones are negative since you are complaining of lower abdominal pain. I will give you an injection of cytotoxin 1 for 2 grams given every 8 to 12 hours depending on the severity. The goal is to relieve the pain. The action takes about 5 to 10 minutes. Are you ready? Okay, I will take action quickly and it will be a little painful and uncomfortable. The nurse performed an injection in the upper arm at a 90 danger angle. Okay, the action is over.
Okay, nurse.
Okay, the action is over. If there is anything you need, you can call me. I'm sorry, have a good week.